Hello everyone, I, Dr. Anu Bhatt, Assistant Professor from the Department of Pedodontics and Preventive Dentistry from BBD Dental College, Lucknow, is going to present the presentation on the topic that is pedodontics. Next slide, there is the difference between the child and the adult patient, which includes first there will be physical differences between the two. Secondly, there will be emotional and psychological difference. Then third one is type of a treatment. As obvious, treatment should be given in different modes to both. There will be different treatment for children's and there will be different for adults too. Then lastly, there is dentist-patient relationship and parent-dentist relationship which plays a major role in it. Next slide, there is physical difference. It's quite obvious that they both will be physically different. For example, their body size. Less drug is needed. Smaller the patient, the higher is the basal metabolic rate. The next is body fluid. In this, the volume of distribution of drug is large in children. The children with smallest percentage of body fat does require a smaller dose of lipid-soluble drugs. And then next slide, which includes respiratory system. In this, respiratory rate higher increases risk of airway obstruction, gastrointestinal system, which includes decreased acidity, altered hepatic metabolism, as it will affect its liver also, patient's liver. Then there is renal system, which includes the glomerular filtration is not well developed. Also, there will be tubular secretion that will not be developed properly, which will give rise to a renal dysfunction. There is cardiovascular system. Cardiac output, heart rate and strong volume. Related blood volume in children is greater at birth and it will gradually decreases with age. There is cardiovascular system. Cardiac output, heart rate and strong volume. Related blood volume in children is greater at birth and it will gradually decreases with age. Next slide, you can see the dentist-patient relationship and dentist-parents relationship. This you can see in these images. There is nothing to describe it. To the next slide, which includes responsibility of the pedodontist towards his patient, which includes there should be good judgment, performance should be best at his level, he must be able to handle the children well, prevention main aim, then last is must convey the value of good dentistry. Coming to the next slide, which is the continuation of the responsibility of the pedodontics towards his nation. That is lead community programs, conduct preventive programs. Then towards oneself, he should be proud of his profession and able to realize that with increased ability comes increased responsibility. Third is continual improvement in knowledge and practice. And then lastly, refer the patient to other experienced professional whenever needed. Thank you.